Good afternoon, I'm Jingyi. Today our group is presenting on stress in the workplace from a work psychology perspective. To understand the psychological mechanism behind workplace stress, let's consider a seemingly unrelated but very relevant example, a bridge. The design of the bridge is to enable people and cars to travel from point A to point B. However, every bridge has its limit. Excessive load, lack of maintenance, cracks and loosening will gradually lead to collapse. Workplace stress is the same. Whether from a major event or daily pressures over time, employees eventually become cynical, exhausted, and disengaged. Next, Yifan will introduce 3 case scenarios. Claudia and Lili will focus on the job demand resource model and empirical evidence. Paolo will present a real-world case study from NHS England, and then I will outline why organizations should implement this approach. I chose this topic because the increasing prevalence of stress and burnout in various industries. It leads to decreased productivity, high turnover rates, and deteriorated organizational culture. Understanding the causes and taking countermeasures is the key role that psychology plays in helping organizations.
Imagine you're drowning in deadlines, endless emails, and constant pressure. Why does this push so many people towards burnout? Today, we will introduce 3 key models that explains workplace stress. First, the general adaptation syndrome. This model shows how your body reacts to any stress in 3 stages. Alarm. Your heart races, adrenaline kicks in. Resistance. You try to cope with the pressure. And exhaustion. Your energy runs out, leading to fatigue and burnout. Why does it matter? It explains how prolonged stress physically wears you down. But it's too general. It doesn't tell us why workplace factors like heavy workload make it worse. In contrast, the job demand resources model focuses directly on work environment. Think of a job as a seesaw. One side has job demands, heavy workload, time pressure, emotional labor that drain your energy and cause burnout. The other side has job resources, supportive bosses, autonomy, recognition, team support that act like fuel and buffers to keep you motivated and healthy. So why is this model so powerful? It's not only explaining why burnout happens, but also shows how organizations can prevent it by reducing demands or adding resources. It's practical for any industry, though a bit more complex to apply. Gas explains how stress develops in body, while JDR best explains why it happened in modern workplace and how to fix it. That's why our group choose the job demand resources model as our main theory. It gives us the clearest, most actionable bridge from theory to real-world practices, as we will see in empirical studies from public service and healthcare, and in our case study.
Now that we've built our theoretical bridge, let's explore the empirical evidence that proves just how effective the JDR model is as a diagnostic and preventative tool.
To gather relevant data, we looked to research databases such as Google Scholar and UNSW Library. We filtered entries with keywords such as JDR effectiveness and stress and burnout. Sources were then evaluated using the CRAAP framework. For example, is the study relevant to our topic? Or, is the study peer-reviewed and published within the last 20 years?
According to Schaufeli, the true effectiveness of this model lies in its ability to identify specific psychological erosion, especially in the relationship between workplace demands and resources. Schaufeli's research shows that burnout isn't a random bodily collapse, but the measurable result of increasing and incremental job demands. I'm sure you felt it before, the endless to-do list or the constant pressure of urgent emails. Schaufeli maps these out as job demands, specifically categorizing them as psychological hazards like cognitive overload and emotional dissonance. The model's effectiveness lies in the identification of the health impairment process, where specific job demands act as the loose bolts that gradually deplete an employee's energy. By recognizing these early indicators, the model allows organizations to reinforce the structure with targeted resources increased career opportunities or feedback.
Bakker and Demaruti supported that high job demands are primarily related to the exhaustion component of burnout, while lack of job resources are related to the disengagement of burnout. In their study of 374 employees over 3 occupational groups, human services, industry, and transport, they observed that demands such as physical workload, demanding clients, and poor environmental conditions all led to employee exhaustion and mental strain. In workplaces where both categories are simultaneously present, employees are guaranteed to experience stress and burnout. In a follow-up study, Bakker and Demaruti found that employees experience lower levels of burnout and higher levels of engagement when they have greater access to resources such as supervisor support and opportunities for development.
We often think rewards like pay rise or bonuses are enough to stabilize the bridge and limit stress. However, a longitudinal study by Boyd revealed that rewards such as monetary bonuses can minimize stress only temporarily. Instead, long-term resources such as supervisor support, career opportunities, and constructive feedback are all job resources that reduce stress more than monetary rewards.
As well as this, the study above demonstrated that employee well-being can significantly improve with lower job demands. Burnout not only is caused by high job demands alone, but also by an imbalance between demands and resources. This highlights the need for organizations to invest in employee support in order to reduce burnout and improve their performance.
How was the JDL model implemented in real-world organizations? And more importantly, did the results demonstrate improvement to stress and burnout? To find a specific case study on this, our group turned to databases such as Google Scholar, UNSW Library, and PubMed. We filtered out keywords such as stress intervention and JDL model. We were interested in any case study, regardless of whether results effectively reduce stress or not. Without fruitful results, we looked towards Google searches with the addition of keywords such as .pdf and annual report. We also removed JDL keywords since organizations may have implied its method without specifically naming it. Let's consider a case study from the organization National Health Services England. They have the mountainous burden of working with government bodies to plan and fund national health services. Think GP appointments, hospital visits, cancer screenings, and emergency services. Further, they can be responsible for funding the salaries of specialists and hospitals. Their vision is simple: to provide high-quality healthcare for all. Now, put yourself in the shoes of the leaders in the organisation NHS England, as well as their chair, Richard Meddings. So, in our 2023 annual report, which can be found on our website, our organisation had 133,000 staff vacancies. While understaffed, we saw 347 million appointments between 2022 and 2023. This was 13% above the 2019 pre-pandemic baseline. Further, hospital beds were less than half of the international average. Remember, staff shortages and increased workloads are predictors of stress and burnout. We can think of these limitations as the demands part of the JDL model. So, what was their solution? In short, they made attempts to reduce these demands. In response, we approved the funding of over 100 diagnostic community centres across England. This should provide relief to the increasing demands for diagnostic tests, while lifting pressure from hospitals with limited capacity. To further cover for the increasing workload to staff, while saving time and money, our organisation planned for the use of artificial intelligence for cancer screenings through the NHS-funded app. In their 2024 annual report, 5% of the adult population in England were registered on the NHS AI app by March 2024. In this same report, they claim a staff engagement score of 7 out of 10 based on criteria such as "we are a team." This represents an increase from 6.8 in the previous year.
So we adopt this approach. JDL is the most practical for organizations. Empirical evidence shows that high demands lead to exhaustion. Lack of resources causes disengagement. Resources such as supervisor support and constructive feedback reduce burnout more than money. NHS England applies this and shows that by increasing resources in the employee commitment program, such as flexible working, recognition, and career development. Employee well-being improved, where other institutions declined during the same period. The strength is that it fixes the work system, is preventive and sustainable. With all things considered, don't wait until the bridge collapses. Mental well-being is a strategic investment, not a welfare matter.